Ultrasound. Vibrations of the same physical nature as sound, but with frequencies above the range of human hearing.
Dr. Pennison, thank you so much for joining us here today on HealthWise.
You're welcome.
Tell us a little bit about what a 3D ultrasound is and how it differs from the normal 2D ultrasound that we normally hear about.
Sure. Well, a 2D ultrasound generally is a traditional ultrasound that we use for imaging both fetuses and the uterus and ovaries. Basically, a transducer is placed on the abdomen with either a gel or an oil, and a sound wave is emitted from the transducer that will bounce off the object being imaged, and we'll see a picture on the screen. A 2D ultrasound actually measures width and height, and the difference with a 3D ultrasound machine is that its actual depth is added, so you can see a more lifelike or true image of the fetus being imaged, or the uterus or the ovaries or whatever imaging there.
Who needs a 3D ultrasound? Is it something specific that a specific type of pregnancy would need, or a specific type of illness that you would use to diagnose that with?
Well, a 3D ultrasound generally has no true medical indication except in cases of high-risk pregnancies. There's a strong family history of birth defects, especially spina bifida, cleft lip or cleft palate, certain heart defects. We can generally see these in greater detail with the 3D ultrasound. Always a 2D ultrasound is done first, generally around 18 to 20 weeks, and definitely if any abnormalities are noted, then a 3D ultrasound would be performed.
Is there a specific time during pregnancy when it's best to do this? If you do it in the beginning or the end, does that have any weight?
Right. It depends on why you're doing the 3D ultrasound. If it's done just purely for emotional and just the enjoyment of seeing the fetus, then the best time to do it is generally between 28 and 36 weeks. That time the baby generally has a lot more fat on the on itself, and you'll generally see a more chubby, normal appearing baby-like picture. If we're looking for specific abnormalities, then of course we do it at the time that those were initially found on the 2D ultrasound. Heart abnormalities or heart images are best done generally between 24 and 26 weeks.
So it's generally the same as a 2D. Do you have to have a longer appointment? Is the procedure itself generally the same?
The procedure itself generally takes a little bit longer than a traditional 2D ultrasound appointment, just because you're really just dependent on the baby to get into the right position. Generally we allow about 30 minutes for each 3D appointment. That takes enough, that accounts for enough time to take pictures and printing and those kind of things.
Are there any factors that can affect the quality of the images, such as fetal position, and how would you rectify that if you go in and the baby's just turned the wrong way?
Sure. That's the greatest difficulty, is you never can tell what position the baby's going to be in. Generally between 28 and 36 weeks the baby won't be very large, but won't be very small either, so that time frame is optimal. You want the baby to be looking as generally as far away from the placental wall as you can, and to have as much fluid around it as possible. Of course, the umbilical cord usually gets in the way, or a hand or an arm, but that is just generally the way the baby's positioned anyway. It's like a natural position. If the mother is overweight or very large, then that tends to decrease the quality of images, just because the ultrasound has to go through such a large area there. So therefore, small amounts of fluid around the baby would probably decrease the quality of images, or just the way that the baby's positioned generally. We usually encourage our moms to eat or to drink something about 30 minutes before they come in. That way the baby's a little bit more active and generally will move a little bit more, so that we can generally get at least a couple good pictures where the baby's not in a compromised position.
Is it easier for you to determine the gender of the baby at that point if you use a 3D ultrasound?
Not necessarily. I mean, the gender can be determined as early as 17 weeks, and generally we'll do that on a 2D ultrasound. It's very easy to determine gender these days on 2D ultrasound. It will confirm that for sure, but not necessarily easier.
Are the costs that are involved with this normally covered under general medical insurance?
It depends on why you're doing it again. If it's looking for an abnormality that was once found or previously found on a 2D ultrasound, then yes, insurance would cover it. If it's purely just for enjoyment, then it's usually not covered by insurance at this point.
What other areas of obstetrics or gynecology would the 3D ultrasound be beneficial for?
Generally, we use it most often for gynecology. We use it for infertility reasons and just for abnormalities that we find on a 2D ultrasound. We can image fibroid tumors of the uterus. We can image ovarian cysts on the ovaries. We can image polyps inside the uterus. And if there's any congenital abnormalities that would prevent a woman from getting pregnant, generally we can see these in greater detail with the 3D ultrasound.
Does this alleviate the need for some more invasive procedures?
It can. A lot of times we can determine whether, for instance, a woman who's having bleeding problems, if we can do the ultrasound procedure and we can determine there are no polyps there, then we may not have to proceed with a hospital-based or an outpatient-based procedure. But vice versa as well. If we do see something like that, a polyp, we exactly know what we're going in for.
And is there a specific person that you're able to use the 3D ultrasound on that's better? We talked about possibly maintaining a healthy weight, but are there any other factors that could maybe be prohibitive to a 3D ultrasound?
Generally, it's really just the position of the baby and how big the woman is itself. There are different probes to use to try to get around some of those issues. And as far as, how far along you are in your pregnancy, that's the main issue there.
And this is primarily an external, just like a general ultrasound?
Exactly.
What's the actual procedure that the person would go through?
Actual procedure is you go in to the ultrasound room. Generally, you want to have your bladder full. It allows for a little bit better imaging. You lay on your back on an ultrasound table and you expose your abdomen, and a small amount of gel or oil is placed on the abdomen and a transducer is placed on the belly there. It's painless. Most people don't feel anything at all. You may feel a little pulsation as the sound waves move, especially with the 3D because it's a little bit stronger. But it's safe and it's not of any harm to the baby at all.
Is it primarily an in-office procedure?
Definitely an in-office procedure. We do it in our own special ultrasound room, so there's some privacy there. It can be done in the hospital as well, especially if there's an emergency or we're looking for other abnormalities, but generally it's an office-based procedure.
And do you leave with an image, or what type of output do you have if you're just going in to see your baby? What do you leave with?
Well, the ultrasound machine that we have now has capability of producing glossy images, 5x7 images of still pictures, and you can also get a CD printed so you can put it on your computer and share it with friends.
That sounds wonderful. Is there anything else about this new technology that people should be aware of or that can be beneficial for someone who's either just starting out in a pregnancy or possibly has some other female problems that they would like to have, some more information on this?
In pregnancy, it's really interesting. A lot of women are unsure if they want to spare the expense of having it done, since a lot of times it's not covered with insurance. I find it helps with the mother to bond with the baby before it's born, and even maybe for the fathers a little bit more so, since they're not intimately involved with the pregnancy at that point. And then it gives us a second chance to take another look at the baby and make sure we haven't missed anything early on with earlier screening ultrasounds. That's about it.
What about any other gynecological issues?
The main gynecological issues would be really abnormal bleeding. We look for polyps and the fibroid tumors doing the pelvic ultrasounds. The new thing that's coming, that's very popular these days, is intrauterine devices. And a lot of women are worried whether they're in place and working correctly after a couple years of use. And we can see these very well on 3D ultrasound to reassure the patient that it's working well.
Dr. Pennison, have you ever had someone come in for an ultrasound and you just weren't able to see anything?
It happens quite often, actually, and it, again, depends on what time during the gestation the actual pictures were taken. But generally, if we can't see anything after 30 minutes of trying really hard, changing positions and those things, we simply have them reschedule in a few days or to a week and ask them to do some of the things that we talked about already, to drink or to eat something before they come in, and maybe this time empty their bladder instead of keeping their bladder full.
What is a 4D ultrasound? I've heard of it, but I've never actually seen one of those either.
A 4D ultrasound is basically the same thing as a 3D ultrasound, where the image is captured in the same way and we measure length, height, and depth, but it's actual a live image where we actually see motion involved there. We can't actually capture that on a picture or a CD-ROM. It's just something that you'll experience at the time of having the ultrasound done.
So is the quality of the 2D, the 3D, and the 4D ultrasound primarily all the same? Do you get the same images?
It depends on the machine that you use. We use the highest quality machine available and the most up-to-date machine. The 2D images are actually what most people are familiar with, the black and white outline image of a fetus or an ovary or a uterus. The 3D images actually have kind of a brownish color to them, and a little bit more lifelike in actual sketches and those kind of things. And then the 4D, of course, like I said, is just an actual image, and you can actually see the baby moving. But it is kind of slow, almost delayed images that you can see there.
Dr. Pennison, thank you so much for joining us today. We hope we've provided you with some beneficial information, and we hope you'll join us again here on HealthWise soon.